So the federal government announced today that they are extending some key pandemic benefits that I know a lot of people watching the show rely on. Among the changes is an increase to the maximum period people can receive employment insurance. Eligible recipients will be able to claim EI for an additional 24 weeks, increasing the maximum to 50 weeks. For those who can't claim EI, there is still the Canada Recovery Benefit. The period of eligibility for that is being extended to 38 weeks, up from 26, so that's an extra 12. The same extension is being granted to the caregiver benefit for those who need to take time off to look after a dependent. Lastly, the new changes would double the length of time you can be on paid sick leave. The Canada Recovery Sickness Benefit increases from 2 weeks of coverage to 4 weeks. So, how quickly will the government make these changes? Employment Minister Carla Qualtrough joins us from Delta, British Columbia. Minister Qualtrough, welcome back to the show.
Nice to see you.
So extensions to CRB and EI and a doubling of the sickness benefit from 2 weeks to 4 weeks. How quickly will these extensions come into force?
Well, on the recovery benefits side, we will make regulatory changes so that there won't be any disruption in someone's benefits. So when their benefits are ended or current benefit exhaust, which will be at kind of end of March, people will be able right away to access new weeks as they need them. In terms of EI, we have to make the EI changes to add additional weeks to EI through legislation. So our intention is to work with opposition parties to get that law in place. So again, on the EI side, there's no benefit disruption. Our goal is really not to disrupt benefits at the end of March.
So how quickly can we see that legislation? How quickly can we see that get through? I mean, have you started these conversations with the opposition parties yet?
Well, we just made the announcement today, and I know our House leader is already hard at work behind the scenes working with opposition. And we intend as soon as we can to get legislation through the House. It's a very simple change to EI where we just add a number of weeks. So we're going to keep it, precisely to this particular issue and hopefully get it through as quickly as we possibly can so that we can ensure, as I said, that benefits aren't disrupted. We don't think it should be a problem. Opposition parties have been very good, ultimately, at the end of the day, with working with us to make sure Canadians get the benefits and support they need.
So when the Prime Minister made this announcement today, the extra 12 weeks for CRB, 24 for EI, and 2 on sickness benefits, he gave us the durations and the extensions, but he never gave us a dollar amount. Have you got a sense of how much this is going to cost?
I sure do. And let me say that what we're focused on, as was said, on making sure that Canadians have the support they need. The estimated cost of this initiative is about $12.1 billion. A breakdown of around $6.7 billion for all the recovery benefits and $5.4 billion for EI.
Okay, so it's about $12 billion, which, is a big dollar amount, but in the context of the past year, it's not a massive dollar amount. It needs legislation. I mean, do you anticipate that this could be the last extension? I mean, it's obvious why the need exists to do this right now with lockdowns still in place in some of the big population centers in the country. How likely is it this could be the last time?
Well, what we're doing today is aligning our recovery benefits with our other emergency measures. So by extending the recovery benefits through June for people, that aligns with how long the wage subsidy is going to go. So we'll be able to look at the labor market situation leading into that period and decide which ones, if any of them, need to be extended. The nice thing about the recovery benefits is we built this flexibility into the legislation in September so we can add additional weeks rather quickly through regulation. EI is a little different, which is why we've extended the EI more weeks so that we only have to go back to the House once for an EI extension. EI, you get 24 weeks up through to the end of September. And we're really trying to make it as easy and flexible and predictable for Canadians. I mean, even just compared to what we were announcing last year, we're trying to build some certainty into this for Canadians because we know more.
So the extension aligns it with the other programs. How will you know when it's time to wind these programs down? Is it based on economic data like the job market? Is it based on the rate of vaccination and where we are in terms of how many needles we have and how many arms? Or is it a combination? Like, is there a metric we can point to and watch to know when things will try to return to an economic normal?
Yeah, I mean, I would say that our economic measures have been so intricately intertwined with our economic measures that between economic and public health, there's really no light of day. So we put sick leave, for example, in play as a public health measure that has economic consequences and economic benefits. But we're really going to look at everything you just said. So we've been looking, for example, at the labor market for the past couple of months to see what would happen as we went into the second wave. Clearly, unemployment rose in January. Lots more jobs were lost. So we knew workers were going to need some support past March. We're going to do the same thing moving into April and May to see what we can being closer to that deadline, what we can predict and see how we can continue, or what we need to do to course correct and continue to be there for Canadian workers and in businesses.
Right. You mentioned sick leave, and some of the latest data that has been out there is that the take-up on this program hasn't quite been as high as some people have hoped, and there's still pressure in places like here in Ontario where people want Premier Doug Ford to bring in a provincial version of the program to either supplement or enhance on what's there. I mean, is the sick benefit working as you had hoped? Are you getting the take-up you wanted to see, or is this something you need to change beyond just extending the weeks of eligibility?
Yeah, I mean, I'd say a couple of things. First of all, the take-up is lower than we predicted, but we've really dug in to try and figure out why that is. A lot of employers are letting people take time off to get tested, now to get vaccinated without, in fact, making them lose income. So they're not actually needing to claim this benefit. Lots of Canadians are on EI right now, EI sickness. Lots of Canadians are on the CRB and aren't necessarily switching over to the sickness benefit, even if they take a week, even if they're ill for 2 or 3 days, or they go to take a test or get vaccinated. This is a function of the duration of our benefits with 2 weeks. So people can only take it for 2 weeks. Now, of course, it's 4 weeks, which is great news for our frontline workers, many of whom have exhausted the first 2 weeks and still may find themselves having to self-isolate. But the reality is this was always meant to be a kind of baseline measure for every worker in this country. And we've always encouraged provinces to enact complementary measures. Yukon has, BC has. I would suggest Ontario has an opportunity to put in place, and of course we're willing to work with them, a really complementary paid sick leave program for Ontarians, and I think that would be great.
So, Minister, your analysis is that the take-up on the sick benefit is low, not because of problems necessarily with the program, but because employers are being reasonable and other existing programs allow for people to take the time that they need.
Well, that's definitely part of it. I would say that the fact that this benefit is paid out in weekly installments has been a challenge for some workers who don't need to take an entire week off. That's just how our delivery model works. What we built in again to the legislation is you only have to have lost half of your work week in order to qualify for a full week's pay of paid sick leave. But I understand it's really tough. And again, this is one of the things that provinces can step in and do. If workers need 1 or 2 or 3 days, potentially they could enact these kinds of programs to complement what we're doing at the federal level.
Well, Doug Ford, for example, has said he doesn't see the need to do that it would be dipping into the Ontario Treasury to replicate something that exists at the federal Treasury. But the way you're kind of defining it, you still see a bit of a gap there that maybe a province could fill.
Well, I certainly can see how beneficial it is in provinces like my own, where there are additional supports available to workers that really complement what we're doing at the federal level. And I've heard from provincial and territorial leaders and at the employment minister level, that same perspective. I don't share it. I think there's always an opportunity to do more for workers.
Okay, Minister Qualtrough, thank you for your time.
Nice to talk to you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.